Dengue fever is a viral fever which is being transmitted by mosquito, Aedes mosquito. So other viral fevers usually which we have is like transferred from the person to other person, maybe by sneezing or coughing, or maybe via fecal-oral route. But here, a mosquito is actually transferring the disease from one person to other person. This is the like epidemiology of the dengue. And pathologically, dengue fever might be a mild and it can be extremely severe. Like when a dengue virus enters, it will cause certain reactions, and because of which the platelets, like which is responsible for clotting the blood in normal home and maintaining the normal homeostasis, those things will be decreased. Hemoglobin might decrease. Patient might go into shock. The blood pressure might fall, and a catastrophic event may take place. So usually in normal cold and cough, the virus like stays for 5 days and goes away without doing much harm. But in dengue, many patients will experience stages where the patient might go even into a shock kind of stage, or there can be decrease in platelets and the blood pressure, decrease in hemoglobin. These can take place. So dengue is actually much more serious problem than any normal common viral fever. Like the mosquito and human are the host, then there is environmental factors, and these three like group, the mosquito, the human, and the environmental factor, all the three combinations are required for disease transmission. Patient will come with features of fever, joint pains, a body ache, myalgia, and headache, specifically retroorbital. Like the patient will feel pain in eyes, and this will be the common symptoms, retroorbital pain. These are like the stage one of dengue. When the patient will come in a severe stage, the patient will come like drowsy, altered sensorium, the blood pressure will be low. There might be bleeding manifestation, like there might be gum bleed, or like easy skin prick bleed, and all these things. There might be shortness of breath, and they are like the severe forms of dengue. Dengue is detected if it is in the first 5 days. We do a dengue NS1 test, like the surface antigens are tested. And if it is after 5 days, then we go for the serology test, like the IgM and IgG antibodies are tested via ELISA method. This is the most common method. There are other tests also, but mainly these antibodies are tested. So if any of them are positive, then we say that the patient has dengue. If a patient has dengue and the platelets are more than 1 lakh and does not have severe symptoms like shortness of breath or altered sensorium, blood pressure is normal, patient can stay at home. And but the patient needs to drink a lot of water, because internally the patient will be dehydrated and sudden drop of blood pressure may take place. So a lot of water needs to be consumed by the patient, and some blood test needs to be done, maybe in alternate level if possible, alternate days if possible. They are like the platelet we need to check, and the total hemoglobin, complete hemogram may be a good test where we can check whether the person is dehydrated, the platelets are low or not. These things need to be monitored. If BP machine is available at home, we need to monitor the blood pressure every 4 to 5 hours. And if it is normal, there is nothing to worry. But if the patient has a decreased blood pressure, and if the platelets are low, like below 1 lakh, and there are bleeding manifestation, like while brushing there is gum bleed, or as such the patient is having bleeding manifestations, then to stay at home is something which should not be done. Admission should be done to a hospital, and patients are given a lot of fluids, and they are monitored in a frequent way. And these are the things which the patient should not, like we should not take the risk. If the patient has such symptoms and staying at home, do not do that. Usually if it is a mild dengue, then maybe 3 4 days or 5 days is sufficient to recover from the disease. But if a person has gone to dengue hemorrhagic fever or shock syndrome, when there was decreased platelet and blood pressure was decreased, then there are certain criteria which needs to be fulfilled before we give discharge. Like the patient should not have fever for at least 24 to 48 hours. The patient should be clinically stable. Like the patient should not look drowsy and all. Patient should be clinically stable. Urine output should be good, and platelet should be more than 50,000 at least. So these are there are certain parameters based on which we discharge. So it might take 5 days to 7 days in case of like mild, and in severe it might take 8 to 10 days also for the patient to recover. Dengue takes place because of the transmission from mosquito bites. So obviously we cannot stop the virus transmission because it is a complicated mechanism, but we can prevent the mosquito from spreading it. So all the preventions like the hygiene, and there should not be collection of water in and around the mosquito like transmits the dengue virus is a daytime feeder. So at daytime at least we should do the fogging and all, the anti mosquito fogging it should be done. So it is more of preventing the mosquito to breed and increase its number, because if the mosquito numbers are less, then we can fight dengue. Also to use mosquito nets at home, and places where there are epidemics, there are like the mosquito nets also have insecticide along with it, so that if the mosquito sits on the net, it will be the mosquito will die. So that kind of and like insecticide spread mosquito net should also be used, and all hygiene maintenance should be done, that mosquito collection does not takes place at in and around the house.